Hello and welcome back to the Fight Back Falls channel, where we aim to educate, equip, and enable you on your journey to fighting falls and taking back control of your life. Now, before I continue this video, I'd like you to like, share, comment, or subscribe to this channel for enabling or allowing you to fight back falls successfully. Okay, so in today's video, I'd like to talk about how does hunchback or round back increase your risk of falling. Now, we all know the term hunchback or round back, and it's essentially a rounding of the normal curvature of the spine. And usually this is an excessive, so normally or naturally, or spine curves, but with when this is in excess, such as the diagram you're looking at now, what happens is that it causes problems basically, and it could increase your risk of falls. This might be news to you, or it might be something that you already know, but I'd still like to share a few facts with you about hunchback and how that increases your risk of falling or could increase your risk of falling. Now, hunchback, as you know, can be developed through poor posture, and that includes slouching, leaning back in chairs, and carrying heavy bags. But it can also be caused by problems that you were born with, so problems that developed in the spine whilst you were in the womb. And also, it could be due to abnormal shaped vertebrae. That's the little bones in your spine. And with aging, unfortunately, you can have what we call spondylosis, which is a degeneration of the disc, and sometimes that can cause pain. And it's just general wear and tear over the years of the spine, the bones, and the ligaments around the spine. And then it can be caused by trauma. So whether that, such as in a road traffic accident, and basically what happens is that with bone healing, you will have deformities, and those deformities can result in that curvature of the spine or increased curvature of the spine. So there are a few things that this curvature is associated with, and it includes osteoporosis. Osteoporosis is usually commonly seen in post-menopausal women, and predominantly there's an increased incidence in women of Caucasian origin. And basically, the osteoporosis, or you might know that as brittle bones, what that does is to cause the bones of the spine in particular to collapse. And with osteoporosis, you can have fractures without doing much or without much force to cause the bones to break. You've got degenerative joint disease, impaired lung function, decreased physical function. You find you're moving slower, you're not moving as much as you used to. The muscles get weak, the joints get stiff, and you can go to the video that I've done on stiffness and how that impacts your risk of falls, to give you a better idea of how stiffness affects that. But your decreased physical function, you're not moving as much as you used to, you're spending a lot more time sitting down, which then encourages that slouching posture that I spoke about earlier. And it's also known to be associated with increased mortality, because don't forget, the vital organs of our body, including our lungs and our heart, are in that um, thoracic area, which is the area of the spine, the thoracic spine, which forms that increased C shape, which then increases your risk of falling. So it's just associated with these conditions. It's not a cause of these conditions. So how does hunchback, or the scientific name or the posh name for it is hyperkyphosis, how does that affect your or cause you to fall? Well, basically, it changes the biomechanics of the body, and therefore it causes your muscles and joint function to decrease over the long term, and this could develop in stiffness, um, decreased flexibility, because you're in that one posture all the time, and it could also cause impact your speed of how you react to things that throw you off balance, whether that's an obstacle on the floor, maybe that's a pet running around the house. You come upon a slippery surface without recognizing that was a problem. You misjudged the height of, let's say, a step. All these things, but because you're in that kyphotic posture, or that hunched posture, that's going to affect how you respond to something that would throw you off balance, and therefore increase the risk of falls. Okay, so because falling, especially in the over 65s, is a hot topic, a lot of research has been done, and one of these areas that they looked at was, how does having a hunched posture um, affect or increase your risk of fall? And if you do fall, could you sustain injury or not? So they had a look at men and women, and the general outcome is that having a hunchback can predict your risk of falling. And they found that females were 1.5 times as likely to fall and have an injury over within 12-month period or a year. But other factors, as women got older, other factors superseded the hunchback impact, meaning that women, their muscle strength and their fear of falling, sort of, which are also risk factors, those superseded the effect of having a hunched posture. In terms of men, they found that men were at an even greater risk of falling. But not only that, that they were more likely to sustain injury as a result of the falls, and that is those men with hunchback. And they found that within this group, that they, if you think your health was poor, if you were using alcohol excessively, and with an increase in age, it was found that men were more likely, with a hunchback, were more likely to fall and sustain serious injury. So, that's massive. Whereas, like I said, with women, they it took them a shorter, sorry, they were less likely to sustain a serious injury um, compared to men, but they were just as likely to fall, have at least one fall in a year, and the injury and likely sustain injury. So, what can you do about it? Well, we can see that the hyperkyphosis is as a result of, or could be as a result of, poor posture. Naturally, if you were born with this problem, no amount of intervention except surgery will be able to change that. Okay. But there are things that you can do. So if it was more of a lifestyle choice or lifestyle posture, then you can avoid slouching. So getting up and moving around more frequently, sitting correctly. There are a lot of things out there on the market that you can use to maintain an ideal posture, if you like, and prevent slouching. There's also, you can do simple things like just rolling a blanket and just placing it in between the seat and your lower back. And also, you can do a roll a blanket as well, and put it vertically between your shoulder blades and sit back. That will help to maintain a good posture and prevent slouching, and enable you to sit correctly. You should also avoid heavy bags. So when you do your shopping, do not try to stuff everything in one bag or just two bags. Use several bags, several little bags, and try to balance the amount you're carrying in both hands. Okay, so don't carry 5 bags in one and one in the other, or all 10 bags in one hand, because that's creating that abnormal strain on the spine and muscles, and it's pulling you forward. And I can't stress enough how important exercise is. So, again, remember I said your posture is affecting how you get along with, how you do things, how you carry out your daily activities. And so that's going to impact your joint stiffness, weak muscles, your flexibility. So, your exercise program, you want to embark on an exercise program, regular exercise program, that's going to focus on strengthening and flexibility. And the area of interest is going to be your core. Exercising your core will be essential to combating that risk factor of hyperkyphosis, and that will help you to manage the falls risk or avoid injurious falls. So, activities that you can engage in as well, in addition to the structured regular exercise, will include things like swimming, running, walking, yoga, tai chi. All these exercises will help, or activities will help to keep you on track in managing the hyperkyphosis or hunchback or round back. Okay, so that's it from me for this video. Just another word before I go is that addressing this problem will take months, if not years, because, well, months to be realistic. Because don't forget, this is a problem that has developed over many years. So don't expect to change things within a couple of weeks, or you work on it for 3 weeks and say, oh, it's not working. No, give yourself that chance and that space. Start getting into the mindset that exercising is now a part of your lifestyle for the rest of your life. And it has so many benefits that that's not such a bad thing. So I hope you enjoyed this video. I hope it was informative. I hope I achieved the educate, enable, and equipping when it comes to hyperkyphosis, hunchback, or roundback as a false risk um, factor. Thank you very much, and I'm out.